And good morning and welcome. I am Dr. Peter Holmes, orthopedic surgeon, and I am host of your program, Ask the Doctor. My guest this morning is Dr. Joe Palisota. Dr. Palisota is an anesthesiologist and pain management specialist. We're going to talk anesthesia this morning. If you have any questions for Dr. Palisota in the future, any of my other guests, two ways to reach us. You can reach us through needfoundation.org or fax 696-9012. I'd like to talk about the continued war, battle, discussion about physician ownership of health facilities. Basically, Congress are now extending what they have as a moratorium on physicians building and owning their own surgical centers. Okay? So, first of all, what are we talking about? Well, you've seen them around town, and there's different ones for different things, but basically they're sort of a specialty surgical center. I.e., the one I use is Nix Alamo Heights or Christus Santa Rosa Outpatient, where we do a lot of outpatient stuff, and I get to do my arthroscopes there, and really quick, clean, and efficient. There's heart ones, and there's other ones, there's spine ones. And there's a moratorium now getting pushed by large hospitals into Congress to stop this. So what's this come down to? Well, the bottom line is always money, isn't it? And money is power. And with the new argument that's going to come up with Congress versus physicians, the money-power thing is going to get very important. But I'm going to tell you one thing. These outpatient physician-owned facilities are the way to go if you have that problem. Why go to a hospital when you need an arthroscope in the knee, and in that room they just got done doing a craniotomy, followed by a gallbladder, and now the same team's going to sit there and want an arthroscope your knee? Well, so you wait for all these big cases, then you go in there and get this thing done from a team that's, well, they can do it, but they've done all this other stuff. So it's much more efficient, in my opinion, to go to these centers. Now, costs. You're all being ripped off if you go to a hospital, in my opinion, compared to outpatient center. See, if you go to an outpatient physician-owned center, you pay one price. If you have the same procedure done in a hospital, you can pay up to 2 to 3 times as much in the hospital. Why? Because the government allows for that. Because they want price shifting, where you go in for a simple procedure, pay more than you should to cover for the cost of the patients on Medicare in the hospital. Okay, so no big deal, insurance, right? Well, then your insurance goes up, and also don't forget you have a co-payment or perhaps a percentage of that you have to pay. The other reason hospitals don't like it is theoretically we're stealing the good nurses. No, they ran off the good nurses. You know, there's more nurses not working now than are working. Why? Because of the conditions in the hospitals. Simply the hours and the responsibilities thrust on them and the low pay for what they do. So the outpatient centers give them sort of an option to work. And guess what? They're working there and they're happy. We're not stealing them. We're just getting the ones that were run off by the large organizations. Now see, having a moratorium against specialty hospitals is sort of like if you're a car saying and have a transmission problem, you can't bring your transmission to a transmission shop. No, instead you have to bring the transmission to a big garage that does a lot of stuff. Okay, well, who does a better job perhaps on the transmission? Probably the one that does transmissions all day. So you're forced to go to one that does big stuff and pay 2 to 3 times as much for a less efficient system. Bottom line is this, it's called coercive payments. They're trying to get activity thrown to the hospitals to cover for the Medicare shortage at your expense. You are going to be required, if these are shut down, to go to a behemoth. Basically, slow down the care, therefore slow down the expense, and save money for the government at the expense of your health. These are my opinions. If you have any comments, there is 2 ways to reach me. You can reach me at email, needfoundation.org, or fax 696-9012 to ask the doctor.